Let's discuss pattern differentiation, TCM diagnosis. The four methods, the patient file relevant information according to TCM. TCM diagnosis relies on four diagnostic methods: observation, listening, smelling, inquiring, and palpation, which gather most of the same information included in the Western clinical file. The four methods also gather information that is not typically included or not given much diagnostic value in the West, but is considered relevant for a correct pattern diagnosis. The most salient example are observation of the tongue and palpation of the radial pulses, which prove a wealth of qualitative information indispensable to TCM pattern identification. Integrating the four diagnostic methods, integrate East and West. It must be emphasized that in the practice of TCM, the physician should never rely on one isolated diagnostic method. Information from all four methods must be integrated into the diagnosis. Moreover, in the modern clinical practice of Chinese medicine, the value of integrating diagnostic procedures, concepts, and theories from Western biomedicine is becoming increasingly important. The clinical record for TCM diagnosis. The table illustrates most important items of diagnostic information gathered during a TCM examination. It is also a proposal of the kind of organization a patient file may contain to allow for both Western biomedical and Chinese pattern discrimination diagnosis. So here we have the table of our clinical record, conventional TCM. The information, patient's personal information, the clinical value or relevance, the same as Western medicine. For the family medical history, same as Western medicine, it evaluates the strength of kidney essence. For the lifestyle history, the clinical value, same as the Western medicine, correlates habits, lifestyle, diet, emotional, and social influence to health. For the personal medical history, the clinical value is same as Western medicine. The present conditions, same as Western medicine. It is the basic information for pattern discrimination. For the organ system, same as Western biomedical body system classification, it corresponds the correspondence with TCM organ system. For the specific TCM information, valuable relevant data for a TCM diagnosis. For the physical examination, same as Western medicine, some information with special value to TCM. For example, point and channel palpation, changes in color, temperature, humidity, tension, rigidity, tenderness, etc. For the examination of channels, regions, and points, only used in TCM diagnosis. For the false diagnosis, only used in TCM diagnosis, relevant to pattern discrimination. Time diagnosis, only used in TCM diagnosis, relevant to pattern discrimination. Analysis of information from Western biomedical and traditional Chinese perspective, including integration of complementary findings of each one. Pattern, exclusive to TCM. For the treatment, integrating TCM and biomedical, integrated and according to the needs of the patient. For the follow-up, same for both system, referral, and inter-consultation, instances requiring specialized diagnosis or treatment beyond the scope of TCM, that is specialized or surgical treatment. For the TCM relevant information, for number one, the stool and defecation, we have the remarks. We get the frequency, odor, color, consistency, pain, helps to discern pattern of heat, cold, damp, phlegm, deficiency, excess, cheese stagnation, etc. Number two, urination. We get the frequency, odor, color, pain indicates heat, cold, damp patterns. Number three, the sweat. Um, the, re, uh, the remark is for the presence or absence, amount, time of day when it occurs, subjective sensation of cold or heat, consistency, relation to activity, indicates G and yin deficiency, cold and heat pattern. Number four, thirst. This the remark is the presence or absence of preference for hot or cold drinks, especially indicate for heat patterns. Number five, spleen pattern. This is for the disturbances, dreams, insomnia, indicates heart, liver, and kidney, heart, or spleen heart patterns. Number six, menstruation, frequency, duration. We get the frequency, duration, color, amount, and consistency of blood. Clots, pain, indicates deficiency, excess heat, or cold, chi, and blood stagnation patterns. For the emotion, number seven, the TCM recognizes seven emotions: the anger, euphoria, worry, sadness, grief, fear, and pride. The presence, prevalence of any one of which is seen as a marker of illness, especially indicative of heart and liver pattern. Number eight, the diet. We get the regularity and number of meals per day, amount, specific food eaten. Indicative of food stagnation, indigestion, spleen, stomach, or damp. We get the frequency correlation to patient age, indicator of condition of kidney essence. Number 10, exercise. We get the relevant in relation to strengthening the vital energy. Excess can be linked to spleen and or kidney damage. Number 11, pulse palpation, indicator for the condition of chi and blood in the organ channel system, fundamental for TCM pattern discrimination. Number 12, tongue observation, indicator of the condition of the internal organs and nature of diseases, fundamental for TCM pattern discrimination. Number 13, the pain. We get the nature, the quality of pain, location, regional, and channel organ distribution. This indicates cold, heat, damp, chi, and blood stagnation pattern, useful for pattern discrimination and treatment. Number 14, channel observation, palpation. We get the presence and location of lesions, discoloration, lumps, nodules, abscesses, scars. Correlates to the channel organ system, useful for pattern discrimination and treatment. Thank you for your attention.